All right, hello everyone. My name is Lindsay Brookes. I'm in the Masters of Public Health program, like many of you. And so today I'll be talking about hip fracture prevention. But before I begin, I'd like to give out my thank yous. So first, I'd like to thank my fellow students for joining me on this journey. We're almost done. Congratulations. My second thank you, I'd like to give it to Dr. Racy for answering all my questions over this practicum journey, so thank you so much. My third thank you, I'd like to give it to Deborah Cracknell, who is the project director for the Orthopedic Expansion Project, who I was working under for this practicum. And my fourth thank you, I'd like to thank my parents for allowing me to continue to live with them, because it's housing is very unaffordable these days, so thank you to my parents. All right, so now I'm going to begin this presentation. So the purpose of my project was to provide recommendations on hip fracture prevention strategies to Island Health's Orthopedic Expansion Project team to reduce the wait list for hip fracture surgeries across Vancouver Island. So I'm going to first outline this problem relating to hip fractures. So 24% of seniors die within a year of a hip fracture. The global annual incidence rate of hip fractures is over 1.7 million. By 2025, it's expected to be at 3.94 million, and at 2050, over 6 million. And 75% of hip fractures are for those over the age of 75 years old. And being in Victoria, there's a lot of elderly in this area. And so approximately 28,000 Canadian seniors are hospitalized each year, and this is equivalent to $1 billion in healthcare costs. And more than 95% of these fractures are a result of a fall, so it's also important to consider fall prevention strategies as well. Only 25% of these people who experience a hip fracture return to original level of functioning, so it's very unfortunate. And so now I'd like to put a face to this presentation. Grandma Betty White here. So I know most of you have like maybe grandparents in your life, or you know an elderly person who might be frail, but I'd like to just bring up here Grandma Betty White for my presentation. I wouldn't consider her to be very frail, but because she is older, she is more frail than someone who is younger. All right, so the first preventative strategy that I've outlined is vitamin D supplementation. And so it was found that with supplementation of over 800 international units a day has reduced the incidence of hip fractures by 30% and falls by 22%. A study in France observed a 43% reduction in hip fractures following supplementation of vitamin D and calcium. So an action to consider would be to screen Grandma Betty White for vitamin D insufficiency. My second preventative strategy is exercise. So some studies that I found was that seniors doing Tai Chi found a 43% reduction in falls and 50% fewer injuries related to falls. So you'll see a picture here of Betty White doing some exercises with Britney Spears. Another study that I found with participants who spent less than an hour a week engaged in daily household activities had an 85% higher risk of hip fracture than subjects who spent more than 8 hours a week carrying out household activities. So it's just getting them off their feet, out of their beds, and doing normal activities. And here's a picture of Betty White doing some baking. So she's moving around, got to get the ingredients. It's good that she's been doing this. So she's doing well. So a third preventative strategy is hip protectors. They reduce the impact to the hip by up to 40% for sideways falls from standing. They reduce the hip fracture between 69 to 80%. However, the traditional model right here is ugly. There is poor compliance because it does not look good, it causes rash, and it's extremely uncomfortable. So I found an innovative solution called Active Protective. How it works is that you can wear it like a belt, like so, and it can detect a fall within a fraction of a second, and boom, it pops out like an airbag, and it prevents that dangerous fall that you might have. It's a very interesting product that I found here. So really looking forward to seeing what results from this. So a fourth preventative strategy is an environmental hazard modification. And so a study with 361 participants had 31% fewer falls after having a home assessment. And this home modification program in Hana, Hawaii, found that for approximately $800 of adjustments to their home, ramps, leveling the floors, adjusting the stairs, it was able to save $1,728 per senior in medical costs. In addition to this, a better patient experience because they're not spending time in the hospital. So the methodology that I used for my research, I did a literature review using the following electronic databases: Cinehall, Medline, AgeLine, all with the EBSCO versions. The sample of the terminology that I used was hip fracture prevention, prevention of hip fractures, and vitamin and hip fracture prevention. So a range of different terms. That's just a sample of what I used. A sample of the inclusion criteria used was cohort studies, case control studies, and literature review. So I also did a review of the programs that exist in Canada. So in British Columbia, there's a Falls and Injury Prevention Coalition, and they provide an e-learning course on fall prevention, as well as information on hip protectors. In Alberta, for the fracture liaison services, for less than $60 a patient for every 100 patients they have monitored, they were able to prevent 4 hip fractures, and this was equivalent to $260,000 savings in healthcare cost. This assessment could determine increased need of vitamin D supplementation and exercise programs in their community. So some other programs that I found was in Australia. It's called Stepping On. It's a 7-week program, and they were able to reduce falls by 31% since inception. They're able to incorporate at least of the 3 preventative strategies that I've outlined previously. So in week 2, they talk about exercise. Week 3, they talk about environmental hazard modification in their home. And week 5, they discuss vitamin D supplementation. So another program is in the island of Jersey. They have a program called Call and Check. And so this is where postal workers provide brief social visits to seniors to check in on them, pick up or deliver their medication, and provide reminders for their appointments. They do this about twice a week, and it's for less than 5 minutes at each visit. And this only costs between $6 to $8, and it's covered by the government, the family, or health insurance. And in 3 years, they provided over 10,000 visits in the island of Jersey. And Dr. Colin Partridge from Island Health is exploring this opportunity for Island Health. And I'm really excited about that. So another partnership that I would be suggesting is with global grocery delivery services, such as with Thrifty Foods and Save On Foods. So it's an opportunity to distribute materials on falls and hip fracture prevention in the community. Another is Uber Health, which is recently launched in this new year, and they provide reliable transportation for patients of various healthcare organizations and could distribute materials on fall and hip fracture prevention in the community. Another one is mobile applications. An example is Carrot Rewards. So this was developed by the Ministry of Health as well as various health organizations in Canada. And so they provide different quizzes which test the user on various health issues, and we could focus on hip fracture and fall prevention strategies in these quizzes. And as a thank you for doing it, they get points which they could trade in to go see movies. And so this is a potential of what we could explore here with Carrot. So I've outlined 3 recommendations for Island Health. The first is to a market research strategy for Vancouver Island to better evaluate seniors' understanding and compliance with best practices to prevent falls. The second is to partner with grocery delivery services such as Thrifty Foods and Save On Foods, as well as Uber Health, like I mentioned previously. And the third is to create a program similar to Australia's 7-week Stepping On initiative and focus on the 4 identified hip fracture prevention strategies that I've outlined. The first being vitamin D supplementation, second, exercise, the third, hip protectors, and the 4th, environmental hazard modification. So thank you, everyone. It's been great speaking to you today, and now I'm opening it up for questions.
Thank you, Lindsay. That was awesome.
Oh, thank you.
You're a natural up there. You can take my job for the rest of the afternoon.
Hello, great job.
Well, thank you.
So my question for you is just that active protective hip protector sounded really cool. Is that on the market? And if it is, how much would that cost for someone?
Oh, great question. So right now it's in the prototype stage. It's not on the market yet. So they haven't really outlined the cost associated with it. But it looks like it's going strong. And so I'm really hoping it's going to be successful. And I'm going to stay tuned for updates on that. Thanks for your question. Next question.
I wish we had time for more questions, but I think we're out of time, unfortunately.
No questions. Okay.
Sorry.
Okay. Thank you, everyone. Thank you.